Hey, it's Dr. Kennedy with Spring Creek Pediatric Dentistry. So today I want to talk about a little bit of the difference between what we call a release of tethered oral tissues and what sometimes might be referred to as a snip. And so sometimes I get this question from parents of, does this need to be done again or revised? My child had this procedure done when they were an infant somewhere else and the doctor just snipped it, or they had that done before and we're still having some symptoms or some problems or some day-to-day issues that my child is experiencing where treatment might be indicated again. And so it's important to remember that there is a different approach to treatment sometimes, and a lot of it's based on philosophy and exposure to different types of literature. And what we recommend at Spring Creek Pediatric Dentistry is a full release of tethered oral tissues. And so for the tongue, for example, when there's a tongue tie present, we recommend a full release of all tethered tissues to the base of the tongue, often leaving a wound that is shaped like a diamond. Typically, if we only use scissors or another method and snip the most forward part of that tethered oral tissue, we're leaving behind under the base of the tongue a significant amount of tethered tissue that can still lead to problems later in the future. It also applies to the lip. If we're only removing or releasing or snipping a small portion of that tethered tissue underneath the lip where it connects to the bone, then we're not getting the full release where we now have full lip mobility, full movement of that lip around the teeth, around the gums, to either achieve healthy breastfeeding or achieve lip motion or tongue motion to achieve healthy speech development. So if you have questions about that and you want to ask myself or a different provider, remember that sometimes terminology is important, and a snip may be insufficient even though it might be quick and be described as being easy. Sometimes, and many times, what we recommend is a full release of the tethered oral tissues to promote full healing.